you're not too young to have high blood pressure. We are not too young for high blood pressure.
Hey besties! We're back for another fun-filled, wonderful episode. And this month is Heart Health Month. So in honor of that, we're wearing our red, blinging it out, you know. And so we decided to dedicate this webisode to Go Red for Women.
Let's be honest. I mean, we're young, we're vibrant. We can't have heart disease, right?
No, of course not.
Right. False. Yes, we can.
Your heart pumps to all the organs. You need it for pretty much every part of your body. I mean, when you're in spin class, getting it in, or, you know, at the club, trying to get it in. Yeah, your heart needs to pump for that. Or when it melts, when you see the birth of your new child, or when you see the love of your life and your heart skips a beat, or when he makes you mad and your heart is on fire. So we have to have more appreciation for all the wonderful things that our heart does.
The biggest misconception that we hear out there is that women don't get heart disease, and they also don't get strokes or heart failure, but that's just not true. Cardiovascular disease is killing 1 in 3 women. So that's a woman a minute that dies from one of these diseases.
Crazy.
It's just out of control, and we need to do our part to make sure to get that number down. Even in our 20s and 30s and 40s, we can still be affected by heart disease.
So this is for you, our young, fabulously fierce besties.
Stay tuned. What is high blood pressure? We hear it all the time. Blood pressure is the force that the blood exerts on the blood vessels as it's making its way through. What is a normal blood pressure? It's 120/80.
What?
When the blood exerts too much pressure on the walls, that's when you have high blood pressure. And that constant force of that blood on the vessel walls can cause the vessels to become very weak, very thin. They can balloon out and cause something called an aneurysm, and they can burst. In addition, the pressure can also cause other substances to stick on the blood vessels, and you end up getting plaque. So because we have blood vessels in all parts of our bodies, that means high blood pressure can affect all parts of your bodies. It can cause stroke. It can cause problems with your vision. It can cause heart disease. It can affect your kidneys to the point where you need dialysis. It can also affect your legs and your circulation, where you'll be having numbness and tingling. When should you start getting your blood pressure checked? You may think that it's just your mom that needs to get her blood pressure checked, or your grandma when they go to their doctor's appointment. But guess what? You do too. So blood pressure should start being checked at 18 years old. Once you turn 18, you should be seeing a regular doctor every year and making sure to get it recorded. And this is especially true if you know you have high blood pressure in your family. If your mama got it, your grandmama got it, your granddaddy got it, your uncle got it, everybody got it, what makes you think that you're not at risk? So go ahead, get it checked. So if your doctor does tell you that you have high blood pressure, what can you do about it? So of course there's medications, and that's one way to go. But usually before you start medications, you'll start to try to do some diet and lifestyle modifications in an attempt to maybe prolong the time before you need medications. So these include exercising regularly, eating well, staying away from salt, staying away from a high-fat diet, and as well as keeping your stress down, right? So your stress, your anxiety, your worry, that all affects your blood pressure as well. So stay stress-free, eat well, exercise.